Confused about value-based payments? Don't worry. The Care Transitions Network can explain it, and we'll do it in just a few minutes. First, what are we talking about when we talk about value? Simply put, value can be broken down to a simple equation where we consider the quality and cost of care. High-value care is delivered with the highest possible quality at the lowest possible cost. In a fee-for-service model, providers have incentives to do more. The more tests you order, the more patients you serve. The more procedures you perform, the more money you make. In a value-based payment or VBP model, providers instead have an incentive to focus more on the triple aim: improved patient experience, improved population health outcomes, and reduced cost. There are many forms of VBP models, and one size does not fit all. VBPs include pay-for-performance contracts that reward providers for reporting on certain quality measures, all the way to population-based payments, which make the provider accountable for the health outcomes and cost of care for an entire patient population. The shift from the fee-for-service model to value-based payments is already well underway in New York State and across the country. So what will this mean for you as a provider? As a provider, you may interact with multiple payers, including Medicare, Medicaid Managed Care Organizations or MCOs, and private payers. You will also likely partner with other providers. For example, you might contract with and receive payments for your services through a larger provider organization. Each payer will have its own definition of what value looks like. Some payers' arrangements may reward quality, pay more for more effective care, or enable you to share savings through incentive payments. Some payers will pay less for less effective and lower quality care, or penalize readmissions, while others will pay for the outcomes you produce, or pay specific case rates or capitation rates. All of these different payer types and VBP models have one important thing in common. They all require you, as provider, to demonstrate your value. So if you're contracting with a payer or partnering with other organizations to engage in a VBP contract together, what do you bring to the table? Think of the triple aim. Can you demonstrate high levels of client satisfaction through tools like the Consumer Assessment of Healthcare Providers and Systems, or CAHPS survey? Have you moved the needle on key quality measures like significantly reducing hospital readmissions or emergency department use? Are you able to provide the same quality care as competing organizations, but at a lower cost? If the answer is yes, you're in a stronger position to enter a VBP contract or join other behavioral health organizations to share risk. If you're not quite there yet, don't worry. There's a lot the Care Transitions Network can do to help you get ready. The Care Transitions Network is a part of the 4-year CMS-funded Transforming Clinical Practice Initiative and can help your organization build the core competencies that are necessary to succeed in a VBP environment. Our practice coaches work one-on-one with your practice to get you ready for VBPs by strengthening population health management, risk stratification, and continuous quality improvement. Confused again? Then check out our next Big Ideas Fast video, which explains how population health management and stratifying risk can improve quality of care, increase efficiency, and reduce your cost of care. Thanks for joining us!